What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering the homeless people and how Xray gets involved when you work in the emergency department. So to give you context, I'm a night shift Xray tech. Been doing it for about 4 years. And depending on what kind of emergency room / hospital you work at, you will have to take care of the homeless people. They will come, especially if you work night shift, you'll get a lot more in the middle of the night. That little 12 a.m., 3 a.m. threshold is when they come out and join us a lot of the times. So my hospital where I work at is a county hospital, Trauma 3 ER. So we can't say no to nobody. Now, obviously, if they come in and they're being mean, if they're being a type of way, we can deny patient care after. Like, we have to establish patient care and then do a little assessment. And then depending on how they act or prior interactions, then we'll kind of base on if we go from there. Usually, if they don't want to have the patient there no more and they're trying to get rid of him, like, usually, and it's kind of messed up, they'll order a chest x-ray just to discharge, which is kind of messed up. We've caught them many times they'll do that because it's like the easiest thing for them to say they did something so they can get rid of them. It's kind of messed up, but that is some of the things we see. Sometimes patient will come in and you can kind of tell that they just want pain meds, and they'll say some random part is broken or they hurt, and then we'll do the x-ray and then nothing's wrong with them, and then they'll just get discharged like right after. We've seen that many times. Other times they do come in and they're pretty messed up, and we'll take care of them and we'll do their x-rays. Obviously, you got to clean extra good after certain occurrences. In the winter time, you get a huge influx of them because, especially if it's cold outside, they want somewhere to warm to sleep for a little bit. There's been many times we get a flux of them. They'll order stuff and they'll just be passed out, like knocked out, and they'll just be trying to sleep the whole time while we try to perform the exam. And it gets kind of, you start to question whether, like, your ethics starts to come in, and you're like, do I want to know what's going on? Does he really need this? And it kind of irritates you because then you're like, well, for me to be able to perform this exam optimally, I have to let up, and you're getting doses of radiation, and you're like, the patient don't care. You start to, it's always a thin barrier and like that, but you do get a good amount, especially at nighttime. You'll get a good amount. I know other hospitals, if someone comes in and they know they're homeless, they get denied, so they know that our hospital has an opportunity for somewhere safe, get a little, or sometimes they will literally tell them, hey, if we give you a sandwich and the water, will you leave? Sometimes I've literally seen nurses will talk with the patient, and then that's all they need, and they'll just leave. So if you check out my channel, I literally post all different types of aspects of this beautiful field of radiology, where I talk about from like very broad aspects to very detailed, where only stuff you can learn on job site training, which I wish I was taught in school, because there's a lot of the stuff you don't learn in school. And I will be more than happy to educate y'all. I mean, if you check out my channel, I could literally post every single day of what's going on in the field, and anything I see interesting at work or something I learned that didn't see at school, I am more than happy to educate the rest. And yeah, it's been your boy Miguel. See you on the next one.